welcome to this week's special comeback edition of the 3 healthcare headlines you need to know from Tallahassee. My name is Fraser Cobbe. I'm the executive director of a number of healthcare associations here in Florida, and this is our weekly update where we bring our members up to speed on what's going on during legislative session in Tallahassee. And I am joined, like usual, with my special co-host here, Joe. Joe, you want to introduce yourself?
Fraser, my name is Joe Daraskevich. I also have the pleasure of working with several societies across the state of Florida, and Fraser and I get together each week and just kind of break down some of the things that are happening over in Tallahassee within the healthcare world. So, Fraser, you ready to get going on this week's 3 topics?
Yeah, let me just explain a little bit. My background picture this week is obviously the Golden Gate Bridge. I'm out in San Francisco, been out here for a conference for orthopedic surgeons from mostly North America, but across the world too. So part of my comeback today is flying back home finally and discontinuing these early morning meetings that happens when you're out on the West Coast. But glad to be with you guys today, and Joe, look forward to hitting these headlines with you.
Come on back to Florida. We'll welcome you back with open arms. So jumping right in, Fraser said comeback edition. Tiger Woods returning to competition this week. It's been pretty exciting to watch. I know we all kind of go into the doldrums after the Super Bowl's over, but this kind of gives sports fans a little something to watch over the weekend. So that's the theme behind the comeback. First question, first topic here. Legislation mandating transparency in practitioner titles is one step closer to making it back to the governor's desk. Fraser?
Yes, so as hinted in the title, this was a bill that passed all the way through the process last year and made it to the governor's desk and was vetoed ultimately. So this legislation is another crack at crafting a package that will provide transparency in healthcare practitioners' titles, and hopefully in its current format from this year will earn the governor's signature, hopefully when it makes it there. So this week's action, it actually passed the Senate, the full Senate, by a 38-1 vote. The House has one more committee to go until it is ready for the full House to consider that measure as well. Simply just tries to provide more transparency in how healthcare practitioners introduce themselves, if you will, to new patients. In particular, it requires more transparent use of name badges and explaining the license under which you're training. So the lack of transparency in healthcare delivery has been something that many physicians have been concerned about with increasing roles of non-physician practitioners in care delivery. So this tries to put in some reasonable measures that say, the first time you meet a patient, you really should explain under what training you've had while you're there before them today. So we think it's a good measure. It gets proactive patient safety measure, and hopefully we will see it pass the final committee on the House and advance like it has done now in the Senate.
Not quite unanimous in the Senate, but just that one vote going the other way. So
yeah, we'll need to dig into that one no vote a little bit and find out what happened there. But
tune in next week. We'll find that voter and maybe another special guest next week. All right, moving on to something we've been talking about a lot this session. Florida House takes another swing at living healthy. What's the latest with that?
Yes, so as you'll recall, what was it, 2 or 3 weeks ago, we told you one of the first bills that passed out of the Senate was the Senate version of Live Healthy. That is the Senate president's major initiative this year, designed to address the increased population here in the state of Florida and making sure our healthcare workforce keeps up with the demand with all those new residents. So the House actually this week passed it out of their second and final committee. So their package, which is $717 million as well, is heading to the floor of the House for consideration. It's anticipated to clear the House without any issues. There was a lot of recognition of all the strong work that Senate President Pasadomo has done, and both on her Senate colleagues as well as over on the House side, making sure that she clears the way for passage of this legislation. It does increase, with all that funding, it does increase a lot of residency training slots in the state. It does expand our loan forgiveness program for physicians to encourage doctors and other practitioners to come to the state to practice. And it does streamline some of the licensure processes for out-of-state physicians as well as foreign trained doctors. Several of the members of the House mentioned a bill that big because it's like 300 pages. It's not going to be perfect. There's going to be things we're going to have to come back in later years to kind of clean up. But certainly it is a massive investment in healthcare workforce here in the state of Florida, which is great to see and certainly something that we support. And now it's onto the Florida House most likely. Next week we'll be telling you probably that it's passed and it's on its way to the governor. So good
Are
news there for sure.
we really knew that was going to be something to talk about every week as we go through. So it's been pretty interesting just to kind of see the different steps and as it kind of gets the language married together throughout the process. We've been really watching that morph and kind of get to
Yeah.
the finish line. Not quite there yet, but we'll keep an eye on it.
Yeah, and we were wondering if it'd get hung up. Usually there's horse trading that comes in at the end of session where either a Senate president or a Speaker of the House has their priority bill they really want to get passed. So the other chamber kind of uses that to their advantage, knowing you want something here. Can you give me something here that I want? But it hasn't really ended up in horse trading at all, which kind of, again, gives credit to Senate President Pasadomo for really lining her ducks up early and really forcing this through without much gamesmanship and getting it passed. So kudos to her. And again, I guess we're a little bit premature because it hasn't passed the full house yet, but most likely we'll be telling you next week that we're good to go with it.
Yeah, we can already pencil that in as one of our headlines next week. Live healthy. We'll be back on that again. All right, third topic, final topic this week, prospects for injured workers getting back to function sooner as Florida House emerges physicians to return to workers' compensation. Fraser?
That was a mouthful, Joe.
Yeah, the
I
second headline was real
challenged you.
short.
Yeah, I challenged you on that headline. I knew
Hey,
you
I'm
had
on
it
the
though.
East Coast still. You're on West Coast time. I can get them out.
Yeah, no, the workers' comp bill is something that we've been monitoring as well. And we've given you a couple updates. I think in last week's conversation, when Jeff Scott was with us, we had a little bit of concern that the bill might be stalled out over on the House side. So the great news and the reason it's a headline this week is we did get that second hearing over on the House side. The State Administration and Technology Appropriations Committee, which is another mouthful. Actually, the chairman was willing to hear the bill and passed it out. It did pick up its first two no votes, so we need to investigate those two. Joe, I think it passed 12-2 out of that committee. So now it's got one more committee left over on the House side. Again, it's cleared all its committees on the Senate. So it's ready for action over there. We've got one more stop here on the House side, which is the Commerce Committee. They have a meeting next week on the 22nd, so we are hopeful it will be on the agenda and we can report to you guys that that bill is on its way to the Florida House as well. It would be another big investment. We shouldn't diminish the fact that the bill, as it increases physician reimbursement to get them back into the workers' comp system, of course, that premium is passed on to businesses in the state. The NCCI scoring at the 200% of Medicare rate level that we're trying to get it to would be about a $300 million increase in premiums in the state, which isn't much. It's like 6.9% premium increase if you spread it across all businesses in the state, but still another large investment in access to care that the legislature is looking at this year, which is great to see. It's for obviously a worthy cause, making sure our injured workers get back to function as soon as possible. So again, another tying in that comeback thing. We want patients to have rapid access to care so they can get back on the job and return to function and being productive, members of society at their job. So definitely look forward to hopefully reporting back next week on that, getting through its final committee too.
Well, and that's something too that we've been talking about is what makes the agenda. You kind of can't look too far into the future, but this is one that obviously we'll be talking about next week as well. Fraser, we're on the back half of the session. I mean, anything kind of on the radar that we need to know about now, or anything that as we get closer to the end here?
No, there's more off the radar than on the radar at this point. Many bills have been left in the dust. I know there was some interest in trying to advance some corporate practice of medicine restrictions to try to decrease the impact that corporations are having on care delivery and ownership of the care delivery process, but that bill hasn't moved anywhere. Scope of practice bills have all died for the most part, so we don't see any major scope bills. So really our focus is narrowing down on those few things that still are alive and have a chance of passing. So yeah, it makes it a lot easier to report. Actually gets it harder to write headlines because there's not as much going on, but from a focus standpoint, it's nice that things are narrowing down here and we can just really train our attention on those things that are likely to get through the process. So
Yeah, and I'm sure there will be some surprises. Obviously, the day to day is going to have different things pop up, and we'll be on top of those as they come along. But yeah, it looks like we have the big fish to keep our eye on, and just kind of finish out this session here with all those things crossing the finish line. Fraser, I hope you have a safe trip back to Florida this week. We're excited about having you back in the Sunshine State. How was California this week? You had a good time out there?
It's cold and rainy, but it's been good. So
Yeah.
looking forward to getting back to the Sunshine State for sure.
Well, it's a little different over here. I'm looking outside and the sun's coming in, so we're happy to have you back. So another good recap this week, and we'll be back next week for 3 more headlines and give everyone the updates they need. Fraser, it's been a pleasure.
Yep. Thanks, Jim. Thanks as always.